Hi, my name is Erin Mckenzie. I'm a current fourth year medical student at the UP campus. I'm currently in the TIP program with the Marquette Family Medicine Residency Program at UPHS Marquette. So the process I went through to apply to the program was similar to how all the other TIP students have gone through. So the application was due in March. I had some I had to send in 3 letters of recommendation, and one had to be from someone from my family med rotation. And then the other 2 letters could be from anyone, but they were from 2 other family physicians I had worked with. That was all submitted in March. And then I completed an interview with the family med residency here in Marquette in April. And then I was accepted in May. So the first big thing for being in the program was that I completed my sub-internship with the family med residency here. And the way that Marquette does that is that they have 2 weeks outpatient and 2 weeks inpatient, all with the family med residency team. So while I was outpatient, I followed with residents, I followed with faculty, and then I also attended their weekly didactics on Wednesdays and Fridays. And I was really just changing up who I worked with every day, getting to meet everybody and learn how they all practiced. And so that was a lot of fun. When I was inpatient, it was with the same team for 2 weeks. And basically a similar thing, just working with the team and all the different faculty and getting to go to the didactics every week. So I really enjoyed my sub-internship, and I did that in September. So after doing my sub-internship, I would spend half a day or a whole day a week, depending on my schedule, with the family med residency in an outpatient setting. And during that time, I mostly followed with second and third year residents. It just varied week by week, and I would change up who I followed with, see lots of different patients, and that was a lot of fun. And then as my schedule allowed, I would also attend didactics. And since I kind of had a long stretch of break there around the holidays and everything, I also spent a little bit of time during break going into the clinic, just to kind of make up for times that I wasn't able to go, such as during my ICU rotation or when I did electives at different hospital systems. So that was really awesome how flexible they were to be able to fit me into their schedules. And during that time, I still followed with residents and the faculty. And so, of course, with COVID, the didactics have moved to be more virtual. And so that's been really easy to fit into my schedule. So no matter where I am, I can kind of attend those didactics virtually with the rest of the residents. And that's been super beneficial because they learn about a lot of different things and also go over some more like housekeeping type things for residency. And so it kind of is giving me a heads up of what residency will be like. Another big part of TIP is completing a project. And so my project has been focusing on social isolation and loneliness in geriatric populations. And for this presentation, I've been doing a literature review and talking to local organizations that elders use. And I will be giving this presentation to the residents during their didactics and also creating a resource that the residents can use to help get their patients connected with these local organizations and to really utilize all the resources that are available to them to help combat some of the social isolation and loneliness, especially that we've seen during this pandemic. And so for this project, I've been assisted by my mentor, who I was kind of matched up with at the beginning of the program, with similar interests to me. And so we check in every month, and she's been helping me with the project whenever I've needed assistance. And she just really kind of is someone that I can bounce ideas off of and who checks in on me. And so it's super helpful. So I've really enjoyed my experiences with TIP, and it's really kind of given me a good insight into what residency will be like and how that transition is. And I really feel it's beneficial to be in something like this and to spend a little bit more time getting to know your options through family medicine kind of can help you see what is important to you and what you want out of your training. And so I really am grateful for the opportunity to have been part of the TIP program, and we've really recommended to people who are interested in going into primary care so that you really know it's something you want to do before you go into such a field with a lot of variety. So